If you wake up every morning and your knees feel stiff, tight, or painful before you even take your first step, you're not alone. And more importantly, this is not just part of getting old. There's a very specific biological reason why knee pain peaks in the morning. And once you understand it, the fix becomes surprisingly simple. I went through the research on this. Here is what I found. When you sleep, your body goes into rest mode, your joints stop moving, and here is the key. Your knees rely on something called synovial fluid to stay lubricated. Think of it like the oil in a car engine. When the engine runs, oil circulates freely through every moving part. But when the engine sits still overnight, the oil settles, it stops circulating. The same thing happens inside your knee. After hours of no movement, synovial fluid stops circulating properly inside your joint. The cartilage starts to stiffen, the joint lining becomes less flexible, and inflammation that was quietly building up overnight has nowhere to go. So the moment you put weight on your knees first thing in the morning, you feel all of it at once. The stiffness, the ache, the first few painful steps. A 2021 study published in the Journal of Functional Morphology and Kinesiology confirmed this mechanism directly. Flexion and extension movements, meaning simply bending and straightening your knee, directly stimulate the release of synovial fluid back into the joint cavity. Movement is literally the medicine. Now here is something most people get completely wrong, and I want to spend a moment on this because it matters. When people wake up stiff and painful, their natural instinct is to rest. They sit on the edge of the bed. They wait for the pain to ease before standing. They avoid putting weight on their knees for as long as possible. That is the exact opposite of what the research recommends. A 2024 Cochrane Systematic Review, which is considered the gold standard of medical evidence, analyzed 139 randomized controlled trials involving more than 12,000 patients with knee osteoarthritis. The conclusion was clear: exercise consistently outperformed no treatment for pain, stiffness, and physical function. Not sometimes, not in a few cases, consistently. Across all 139 trials, the body needs movement to lubricate itself. Avoiding movement does not protect your knees. It makes the stiffness worse. So what is the simple fix? Here's the 2-minute routine I want you to try tomorrow morning before you even stand up. While still lying in bed or sitting on the edge of it, slowly bend and straighten each knee 10 times. Not aggressively, not to the point of pain, just slow, controlled movement, back and forth, gentle and steady. This is called a knee flexion exercise, and it costs you less than 2 minutes. What this does is pump synovial fluid back into the joint before you load it with your full body weight. It is the difference between starting a cold engine gently and warming it up versus flooring the accelerator the moment you turn the key. One of those approaches protects the engine. The other one wears it down faster. A neighbor of mine, 71 years old, told me he used to dread getting out of bed every single morning. The first few steps were so painful that he would grab the nightstand just to steady himself. His physical therapist gave him this exact 2-minute routine. Within 3 weeks, he said his mornings felt completely different. Not perfect, but measurably better. And that is often where real improvement starts. Beyond the morning routine, there are 3 additional strategies that research specifically supports for reducing morning knee stiffness. Let me walk you through each one. The first is gentle heat before movement. Applying a warm compress or heating pad to your knees for 10 minutes before getting up helps increase blood flow and relax the joint tissue before you start moving. A 2024 clinical review noted that thermotherapy, meaning consistent heat application, rake, significantly reduces stiffness in osteoarthritis patients when applied before activity. The key word there is consistent. Doing it once will not change much. Doing it every morning for several weeks is what produces lasting change. The second strategy is quadriceps and hamstring strengthening during the day. Now I know that sounds like a bigger commitment, but the research here is very compelling. A clinical trial published on PubMed involving 96 patients with knee osteoarthritis followed over 8 weeks, tested different exercise combinations. The group that combined both quadriceps and hamstring strengthening exercises showed the most significant reduction in morning stiffness scores of all 4 groups tested. Here's why this works. Stronger muscles around the knee act as shock absorbers. They take pressure off the joint itself throughout the day. Less pressure during the day means less stress accumulates overnight, and less stress overnight means less stiffness and pain when you wake up. You do not need to do anything intense. Even gentle seated leg raises and light resistance exercises done consistently 4 to 5 days a week can produce measurable improvement within 6 to 8 weeks. The third strategy is avoiding long sitting periods in the evening. And this one surprises people, but the mechanism makes complete sense once you understand synovial fluid. If you sit on the couch for 2 or 3 hours without moving before bed, synovial fluid pools and stagnates in your joint before you even go to sleep. You essentially start the night already behind a simple rule that works well. Stand up and move gently for 2 minutes for every hour of sitting in the evening, a short walk to the kitchen, some light stretching, even just standing in place. That small habit keeps synovial fluid circulating right up until you go to sleep, and it makes a measurable difference in how your knees feel the next morning. So to summarize everything we covered today, morning knee pain in seniors is not random, and it is not inevitable. It has a clear biological cause. Synovial fluid stops circulating during sleep. Cartilage stiffens, inflammation builds overnight. And the first step you take in the morning triggers all of that at once. The fix starts with 2 minutes of gentle knee movement before you stand up. Add morning heat, daytime strengthening, and evening movement breaks. The research shows you can significantly reduce morning stiffness within 3 to 8 weeks of consistent practice. None of this requires a gym membership or special equipment, just consistency and an understanding of what your body actually needs. If this video was helpful, consider subscribing to Vital After 60. Every week we break down real research into practical steps you can actually use. Next week, we are covering the specific foods that research shows make knee inflammation worse and the ones that actively help reduce it. That one is worth watching. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your healthcare provider before starting any new exercise program, especially if you are managing a chronic joint condition.